Well, thank you for staying with us. Now it's to talk about mental health. Bello Shuni writes to the Minister of Health, Mohammed Ali Pate, highlighting the critical state of mental health services in Nigeria. The country is facing severe challenges such as the lack of qualified personnel, insufficient funding, and inadequate infrastructure in the mental health sector. Millions of Nigerians suffer from conditions like depression, anxiety, and psychosis, with limited access to care, resulting in increased stigma and discrimination. To address these issues, Shuni urges the minister to increase funding for mental health services to at least 5% of the national budget. Additionally, he recommends developing a comprehensive national mental health policy and establishing more psychiatric hospitals and clinics, particularly in rural areas. He also emphasizes the need to provide scholarships and training programs to increase the number of mental health professionals. Lastly, Shuni advocates for public awareness campaigns aimed at reducing stigma and improving mental health literacy. He believes that with the right leadership and actions, Nigeria can significantly improve mental health services and better support the well-being of its citizens. Now, was Shuni just talking, or these are things that really need to be put in place? How scary is the problem of mental health issues in Nigeria now? To discuss with us is Olakunbi Oyedele, Executive Director, Living Vines Mental Health Foundation. Good morning and welcome to the program, Olakunbi.
Good morning, thank you for having me.
Okay, we've been talking about mental health all the time, but all the time we talk about it, it seems as if it's getting worse. Am I right in my assessment, or is it getting better?
Well, I would say a little bit of both, in that it is getting, at least we are talking about it, so that means that it's getting the attention that it needs to get, right? So that's one good thing about it, that people are becoming more aware that there's a need for mental health services, there's a need for more advocacy, there's a need for more education about mental health. So that's the good thing about it. It's not getting worse. I don't like to use that worse because there's a need for it, yes. And there are people that are doing stuff, but it's just not enough. That's what I'm going to say. There's a huge need for us to do more for mental health, and we're still struggling in so many areas. So we definitely need all hands on deck. We definitely need the support of the government to help us achieve more than we are currently doing.
So what is it that is lacking in terms of policy or anything else that could have made mental health issues come better, or services, mental health services, yes, better in Nigeria?
I think it's a multifaceted approach, layer to this. Like it said, there's just a huge need for stuff. For example, what are some things that are lacking? I could start with the fact that, let's start with the stigma, right? There's still the stigma that we need to address when it comes to mental health. So like that we need to address when it comes to mental health. So we definitely need to educate more people, because sometimes people don't have the language to understand that what they need is mental health. There's a huge rise of attention that is given. So that's good, right? We have the younger people who are advocating or who know more about what mental health is. So there's a huge social media influence that's helped. We definitely also need more people that are trained, right? Like you said in the article that was written, it is the need for trained professionals. We are lacking. There's so many people in universities that study psychology or they study social work, but they are not utilizing that because there's no lack of, this is the gap. There's a huge gap between what people are studying and what is the reality of what they find on ground. So we definitely need the education system to improve so that they can fine-tune their skills so that people can actually service the need for that in the communities. So there's that. There's also the need for, like I said, educating people about what mental health is. There's a huge need of, the government is not utilizing people that are on ground. There are a lot of people that are on ground and a lot of NGOs. There are a lot of NGOs that are doing mental health work and in different areas in Nigeria. But there's no body that is kind of galvanizing everybody and making sure everything, right, that the skills are being felt in all different areas, right? There's no there's no communication, right? There are gap in communication between services that are available and the things that are not available. And so there's no registry where people can go to and say, hey, that's a national thing. The government needs to do that, where there are people that says, okay, these are the areas, these are the people that are providing services in these areas, so we can connect them to the people that don't have services, and so that this is what we need. So there's no registry for that. So we need to provide the registry. So the government needs to do a lot, but I think what we also need to do is educate the public. We can't just leave everything to the government. Who is the government? The government is all of us, right? Where even individuals need to start normalizing and talking about mental health, so that people are aware and people are willing to step up, right? So when people say that, oh, I have struggled with mental health challenges before, other people can also come in and say, oh, they can also talk about their struggle and people can feel connected. So there's a lot of things that collectively we need to do as a society to help improve mental health.
But who should be at the vanguard of this awareness campaign that you're talking about? You said that some NGOs are doing a lot already, but there's no body that regulates and however you put it. But since you say it is not enough, that means the drivers may have to change, or the numbers may have to fill up to make this a success story. So how do we begin? Who runs this? Who will be at the vanguard of all this?
I think, well, first of all, maybe the health minister needs to come in and say, hey, let us, because I know that there's the health minister, there are different commissioners for different states, and so I think maybe first of all, the health minister needs to start and say, okay, see, what is lacking, what do we need? Let us take some kind of registry. Let's find out what's going on, right? How many hospitals do we have? How many, what's the gap in services? So I think that's something that needs to be said, that needs to be done first. And then they need to gather a body. So I think the ministry starts with the federal, right? Let's start with a body of people, bringing people together, right? To say, okay, we are coming from different states, because that's how it's run. And then let's now start building a community to now form a body or form some kind of organization that can kind of manage the system. And so we are doing that at the head. And then we have different state coordinators who are like, okay, this is what we have, this is what we need to do, so we need to push everything out there. So that's one of the first things that we need to do. The health starts from the top and then now disseminates the information to different states, and we now start working towards helping people, helping get all the information that address the lack of access that we have. And then we also need to work in partnership with schools. We need to go to, I'm thinking the education minister, the education minister of education needs to also work in partnership with the health minister, because I believe the education minister was also the health minister. So it's and he's actually a doctor. So I think it actually helped with even linking that up, because there's a lack of services that are being gap of education, right? We need to make sure that the education, the school, the people that are graduating from psychology programs or social work programs are skilled enough to understand what is on ground, so that they can provide services, for the people that need it, right? So there's a huge need for that. And then we now of course, the government also needs to start doing more media work, so, talking about campaigns, right? Including all the NGOs that are involved, and say, okay, how can we spread this awareness? Let's start talking more on TV, talk about social media, let's do things on the billboard, let's take it to the grassroots, let's go to the market people, let's go and say, this is what it is. It's like, how did we overcome COVID? It's a public health problem. So mental health is a public health problem that needs to be addressed the way we address COVID, so that people have an understanding of what is going on and how they can move forward into the next stage.
Okay, let's go back to let's go back to the mental health itself. Now we've been talking about how to improve services and all that, where we need to start from and all. But let's assume that someone is watching this for the first time and hearing about what really mental health is. It seems as if nowadays there are so many things that exacerbate these conditions. There are so many things that are triggers to this mental health problems and all that. So let's get a peek into what really gives rise to these mental health problems, and starting from why it is so important, even if we have never touched it before, why it is so important nowadays to talk more about mental health issues.
Well, I would not say we haven't spoken about it before. I think mental health has always been there. People know about mental health. Everybody has mental health. I think we need to start the topic of everybody has mental health. Not everybody has mental health challenges or illness or disorder. So I think that's what we need to talk about first. But there's always been, I think the people have always been aware, right? Psychosis, we know that, we see people that are maybe on the street or, delusional or having hallucinations, and then we call them insane or mad. So there is always some kind of understanding, right? Even back in the day, before people got married, right, they would go and do some kind of background check, so that they understand what it is that is going on in the family. So there was an understanding of what kind of mental health challenges. It's just that there's still a lot of stigma. There was a stigma attached to it, right? And so people don't have what we need to do, right? People kind of hide when they have mental health challenges, or they shove things away. They don't want people to know, right? But now there is more awareness. There are more people coming out and saying, hey, I have struggled with this, right? I have struggled with that, and people identifying with it. So we have a language. What we need more, of course, because, of course, there's still a need to do more of the education, because there are some people, there are a lot of people that don't really understand it, right? So we need to put a language, and we need to talk about what it is. But we need to first of all understand that everybody has mental health, right? The mental health is the way we think, the way we behave, our emotions, the way we connect with other people. That's what mental health is. It's a combination of our thinking, our emotions, our thoughts, our mind, right? So that's our mental health. We all need to have a functioning mental health, right? Good, where we can, our emotions are in the right, managed well, where we are able to talk and socialize with people. When we have a mental health challenge is when we are, when, for example, we've had a prolonged, for example, these are some symptoms, when they have been from, and it ranges and it differs for people. It can be very different for different people. For example, if you feel like you're out of base, so you have an average way that you behave normally, or you have your emotions that you have a normal range. And then, for example, for a few days in your life, if you're starting to feel like you're isolating yourself, you don't want to be around people anymore, you are feeling down, you don't want to, you are feeling maybe worried, anxious, thinking about things over and over again. At work, you feel like you cannot, you're not complete, you can't, you're distracted easily, you're not able to focus, you cannot concentrate. For some people, right, it's because of stress. They're stressed, and maybe that's why they need to resolve that stress. For some people, it's because there was a huge event that happened in their life that is causing that kind of causing the situation. For some people, it's genetic, right? It's genetic. It's because of there's a link. We know that people have family members that have depression, anxiety, or bipolar have a high risk of actually having those mental health challenges. We also know that there's environmental things that can cause mental health challenges, right? We know that sometimes there are hormones, right? When there are some hormones in the body that actually increases the chance of you getting mental health challenges. So there are so many factors, there are so many things that can cause the mental health challenge. But the truth is, there's hope in recovery. Recovery is very possible. There are so many people that have gone through mental health challenges, have been able to overcome. In fact, they function properly with the right set of help that they need, with the right people, with some people with medication. They've been able to thrive positively in the environment.
So in the course of your work as an NGO, you've interacted with a lot of people. What are some of the challenges that you face that you think everybody else can contribute to make sure these challenges are surmounted?
Well, I can, in fact, if I don't want to go down the list of some of the challenges that we have gone through. We are currently in some secondary schools in Nigeria, in Lagos State right now. We're providing mental health. We have a mental health club where we go to secondary schools to provide mental health advocacy, and we're training children, not just in mental health, we're also doing the substance abuse prevention program. So we're a combination of both. And so what we do is we're in District 1, and some of the challenges that we see is sometimes even the school itself, sometimes some of the staff, unwilling to, they're willing to help the children. They're not willing to, we have struggles with trying to get the kids out into the society. So sometimes it's the adults, right? Because some of the kids are willing, because we believe that in order to address this mental health crisis that is looming or that is already in the society, we have to start with the prevention lens, right? Like I said, it's a public policy issue. And so we have to start with prevention. Let's start talking to the children first. Let's start talking to those people that, so we can develop their skills so they're able to even address some of the challenges that might come their way. So that's one. So one thing we have struggled, like I said, is just sometimes adults, not wanting to help the children. So we definitely need more education on that. Challenges with infrastructure. All right, we have challenges with infrastructure, making sure that our message is disseminated the way that needs to be disseminated. So that's some of the challenges with the schools and all that we've had. We definitely have issues with, like I said, the stigma. People not wanting to even address or accept or that there's something called mental health. But, day after day, one thing that we've done is once people sit down and actually have an open mind to listen and say, okay, maybe there's this, then they're able to actually identify themselves that they have gone through a mental health challenge or they know somebody. And so it's just, first of all, having an open mind and to listen. So that's one thing that we need to do first as adults or in the society. And we also need to talk to other people, right? Once you're able to identify that maybe you have gone through this or you know somebody, be able to talk about it in a free way and that reduces the stigma. So those are some of the things that we can do. And we also need to be educated, right? There's so many information out there. Make sure that you are getting trained, getting information necessary to get trained so that you're equipped with the skills, because we need mental health first aiders. We need people that can say, I can just be, what I can do is provide emotional support at this time. I can just be by your side. And then I can now refer you to appropriate services. So we need middlemen. We need people like each and every one of us that can be trained just to be the middleman to provide the aid so that we can now provide and refer as appropriate. So those are some of the things that we need.
As we wrap up, what's your level of interaction with and acceptance by the traditional institution?
Well, we have tried, what's the level of acceptance with traditional institutions? Well, some communities, depending on the maybe the king or the person that is ruling the society or the area that you're in. But for some people, for some of the places that we've been to, some of the king there or the leader there, they recognize, so some people recognize that there's a huge need, right? They recognize that some of the children or some of the people in their area are struggling. There's a need of education. They understand, but sometimes there's still that lot of stigma. There's still a lot of, okay, what is this? What is this? How is this going to benefit me? Right? How is this going to help me? So we definitely need more training and more awareness to be given to the kings to understand that although mental health is not physical, it still needs to be addressed. Because sometimes people believe that because it's not physical, then there's not a need for it. Why do we have to address this? Since we can't see it, it's not tangible. So it depends. We need to. There are people that are open-minded. There are some leaders that are open-minded, that are willing to come and say, okay, we need this. But there are some people that still don't see the need because it's not tangible. So that has to do with education. Education, letting them understand the impact, letting them understand the fact that we need more, even though you can't see it, but the long-term effect, if you don't deal with it, it will affect each and every one of us in society if you don't deal with it. So some leaders are more welcoming than the other. So it just depends on the person that is leading the community.
Okay, I hope all the traditional rulers and everybody that helps to form opinions in any society will have the mental health enough to understand the need for their people to have this interaction with experts and seek help when they need help. We'd like to thank you for coming on the show this morning. It's a very big pleasure having you join us this morning.
Thank you so much for having me.
We've been talking to Olakunbi Oyedele, Executive Director, Living Vines Mental Health Foundation, and we're looking at mental health issues and the challenges surrounding those. Okay, we're hoping that things will get better, not just in the health sector, but everywhere else in Nigeria. We're hoping for a better Nigeria, but be sure you're contributing your quota. My name is Nyamgul Agaji, saying bye-bye to you, hoping you will rejoin us tomorrow for another edition of the program.